Hello and welcome to the Omnex webinar, Medical Devices Single Audit Program. Today's presenter is John Pappachan, who's a senior consultant for Omnex. John is one of Omnex's practice champions for medical device management system initiatives. He joined Omnex in around 2003. John brings a wide and varied experience involving more than 3 decades of work in a broad spectrum of industries ranging from pharmaceuticals, plastics, stampings, medical devices, food safety, safety panels, and many more. Starting with QMS standards like 9000, 1994, John has a significant experience with a variety of management systems including QS 9000, ISO 9001, IATF 16949, ISO 13485, OHSAS 18001, 14001, 45001. John is a certified lead auditor for MDSAP audit model. Take it away, John.
Hello everybody, this is John Pappachan. I'm the senior consultant and the MDSAP champion for Omnex. Today we will be taking a look at the MDSAP audit model, which is a combined management system audit of ISO 13485 QMS, along with the compliance requirements of all the participating regulatory authorities from 5 different countries. And Omnex is an international consulting and software company. We do implementations and we do trainings and internal audit assessments. We are involved in several different standards like environmental quality, food safety, laboratory, health systems like that. Our presence is all around the world. We have thousands of people working for us, all in 30 different countries, and we've been around from 1985. That's a long time that we've been in the industry dealing with various different standards like 9001, IATF 16949, aerospace standards, and ISO 14001. Also the new standard ISO 45001. Today we will be looking into and trying to understand the MDSAP audit model, where we do the integrated kind of audit between the quality management system requirements and the compliance requirements of various countries. We're taking a look into the MDSAP development, what happened and how it came to existence. The Global Harmonization Task Force was formed in 1992 with a group of people with an intention that we will have a global medical device regulatory system so that different countries don't have to audit the companies for different requirements. And the endeavor was supported by Australia, Brazil, Canada, Japan, and United States. And later, the Global Harmonization Task Force was transformed in 2011 into IMDRF, International Medical Device Regulatory Form. All the work that GHTF has done has been transformed into the IMDRF database, and we are working with the IMDRF now as the International Medical Device Regulatory Form, who are coordinating the MDSAP audit and also coordinating with different regulatory authorities from different countries in the world. IMDRF Management Committee has bodies which provide guidance on strategies, policies, and membership, and those are from different countries in the world who accept the MDSAP model of auditing. And they also oversee the work groups which draw upon the expertise and the group. And IMDRF chair and secretariat rotate on an annual basis between the member countries and the participating regulatory authorities. These are the members that are in the IMDRF. We have Australia, Brazil, Canada. China is as an observer now, and Europe also is observing what is going on with the MDSAP, and Japan, Russia, and Singapore South Korea. All these countries have expressed their interest in having the single audit program, which will combine both requirements. That will be a great help for the companies, for the medical device manufacturer, so that they don't have to have several different audits. These are the members of the committee. They are from Australia, Brazil, Canada, China, European Union Commission of Directorate General of Internal Market and Industry, Japan, Pharmaceuticals and Medical Device Agencies, and Russia also is looking into the possibilities of adapting or watching. They are observing at this time, and they are also part of the management committee. And from United States, we have a U.S. Food, FDA, Food and Drug Administration being the heading agency into IMDRF. There are two observers now watching the development of MDSAP audit and how it is going. One of them as an observer is the World Health Organization, and also APEC, Asia Pacific Economic Corporation also is as an observer and seeing how the MDSAP operations are going on and how it is developing. They are scrutinizing the reports and stuff that is going on like that. MDSAP was developed in 2012 with the goal to create that one system where we will be auditing the requirements of a quality management system like ISO 13485, along with the various compliance requirements, regulatory requirements of the participating countries. This program covers the certification for 13485 and also all the regulatory requirements of the countries. MDSAP is an audit process, audit model that will allow us to audit the QMS requirements and the compliance requirements in one single audit. These audits are being increasingly popular. More and more people are looking into, more and more manufacturers, medical device manufacturers are looking into this system to see how this is developing. There is a vast growing interest around the world about adopting this method and this system. It's a global approach that we can have medical devices and also IVDs to improve their safety and also make sure the manufacturers of these devices meet the legal requirements of the GMP requirements or any other legal requirements of the country about the medical devices also. It's recognized by 5 device regulatory agencies who are participating in the program, and they are the Australia's Therapeutic Goods Administration, Brazil's ANVISA, Health Canada, Japan's Ministry of Health, and the United States FDA. These 5 countries have already agreed that they will respect and they will follow up with they will accept the MDSAP method and they will accept the audit reports. United States already has said that they will accept the MDSAP audits in lieu of the inspections, and Health Canada has made it a mandate that they will be accepting the MDSAP methods from January of 2019 onwards. MDSAP also covers the other requirements of a medical device organization like registration and licensing, and they also give directions from different countries how we should be identifying and reporting adverse events, and it is almost like a complete system of QMS and all the compliance requirements. The model is looking at the specific requirements of ISO 13485. The basic quality management system that needs to be implemented by the manufacturer is ISO 13485 2016 being the latest standard being published. And also in this MDSAP method, if a jurisdiction or if a country, a participating country's regulatory authorities they have other requirements. The MDSAP audit will ask the auditor to look into those requirements also, and also any other country-specific requirements are related to medical devices anywhere in the participating regulatory bodies. There are what are the markets that we have currently if we want to look into the MDSAP? The current markets are USA, Canada, Brazil, Australia, Japan. If companies are if your organization is supplying medical devices anywhere in this market, it is highly important that we look into that and we make sure that we have an approach of MDSAP so that we could meet these requirements and also minimize the number of regulatory audits from different countries and different markets where we are supplying products. FDA went live with MDSAP on January 2017, and they said they will accept the MDSAP audit results in lieu of the routine inspections. They will come and do an inspection if there is something very seriously device-related risk. Is a high level of risk is identified. Otherwise, for the routine inspections, FDA will be accepting the MDSAP audits and audit reports. Health Canada already made a declaration that starting from January 2019, and CAMDCAS will make, or Health Canada will make MDSAP method of auditing a mandatory requirements. So this is really a great opportunity for people who are supplying in these markets. And other countries, other participating countries also are having a chance to make declarations soon that they will accept these programs also. It is very important that we understand how the MDSAP program works, how the audit is conducted, how the reportings are made, and what are the relationship of the regulatory agencies in the participating jurisdiction with the MDSAP and the IMDRF monitoring of the MDSAP activities. As I mentioned earlier, these are the markets where we have a great hope that we will be able to have only one single point audit instead of having multiple audits for the quality management system and then audits by the regulatory authorities from the country's particular medical device divisions, and all those can be combined into one. And the countries that is participating now, as we mentioned earlier, are FDA, Health Canada, and Visa, and TGA from Australia, and MHLW from Japan. Japan already made a statement that they will accept the MDSAP audit reports in lieu of their quality management system, JQMS, Japanese Quality Management System audit requirements. The opportunity here is that we could minimize the number of audits and the interruptions into the management systems and our organizations if we find an auditing organization that is certified and recognized and accepted by IMDRF, and then have them come and do an audit and certify our system. Whenever an auditing organization do an audit, the audit report will be given to all participating regulatory authorities and all participating jurisdictions. And they review it, they take a look into it, and if they have a concern, they may let you know or even sometimes schedule an audit. This was taken from the FDA extracts. If we look in the last portion there, it says that FDA will continue to accept MDSAP audit reports as a substitute to the routine agency audits, establishment inspection reports, EIRs, and also if you are a company who has electronic product radiation control provisions, then the FDA will continue to do the inspections for those areas only. There's a whole bunch of activities going on and happening in Europe. Europe has been participating in the MDSAP first pilot audit, and they are currently staying as an observer, and the concern is that it would be difficult for them to get an agreement from all the member nations, and there are different types of GMPs that each nation has, but they are working on it. There's quite a bit of progress going on in that area. The participation of European notified bodies shows that it is a link between the EU requirements, EU directives, and the MDSAP, and there is a big chance we will have some kind of a declaration about that in the near future. And there's a big optimism in the market that European Union will accept the MDSAP and be part of the bodies of the accepting regions. The intention here is to harmonize the quality management system requirements and the compliance requirements of different agencies, which will, for a manufacturer of medical devices, which should reduce the number of audits. And when a number of audits are reduced, there is a whole bunch of resource requirements being reduced also. And it is the way the world is going, and the MDSAP is now, it is growing faster, and the popularity is there, and more regulatory bodies from different countries are looking into it. And the European Union focusing on the MDR regulations that they have, medical device regulations, and they are trying to see where this can be really integrated or fit into it. Registrars auditing MDSAP already have 13485 and MDD medical device directives backed into the current process audits. And this is giving really a great hope in the medical device industry that European Union will soon accept MDSAP as the method. Now we're looking into how is this done? What is the structure of an MDSAP audit model? The audit model follows a process approach and has determined 4 primary processes, which are the management processes, measurement analysis and improvement processes, design and development processes, and production and service control processes. Purchasing is the other process that is accepted as one of them. Purchasing is considered as a supporting process for all the primary processes and also the additional supporting processes. The additional supporting processes defined are device marketing authorization and facility registration, and also medical device adverse events identification and advisory notice reporting. So altogether there are 7 processes that the whole MDSAP is involved in, and each process has several tasks. And the MDSAP audit is the model is that we will have management process. For example, it has 11 tasks that the auditor will be looking into it. And altogether for the whole MDSAP, there are 90 tasks that the auditor will be looking into it. This is a task-based audit. The MDSAP audit model gives a good direction on what is involved in a task, and we can take a look into that, and what is involved in a task and what kind of regulatory requirements are required for each task from each country, and also if there is any country-specific requirements which is not the common regulatory requirement with the other jurisdictional agencies. As I mentioned earlier, you can see the different tasks, number of tasks on each process here. Management process has 11, device marketing authorization and facility registration, which will be looking into see has the manufacturer already accepted or already got the marketing authorization from the countries in which they are marketing or intending to market, and also did they have the facility inspection and it is approved by the regulatory agencies. And then there is 3 tasks in that area. In measurement analysis and improvement section, which is mostly about process controls and measurements and how to create improvement to the management system, 16 different tasks. In medical device adverse events and advisory notice reporting, there are two tasks that the auditor will have to look into. Each task will have several things that the auditor has to do. And then we have the design and development process. For those manufacturers who are doing the device design and development, there are certain tasks, that is 17 of them, that the auditor will be looking to see, particularly if the organization is meeting the requirements of the design and development. Then comes the manufacturing processes, which is identified as production and service controls. There are 29 different tasks, depending on what the product is and what the product requirements are, if there is sterilization requirements and those kind of things. And there are 29 tasks altogether. They may not apply to every organization, depending on the products, the type of products and the processes and the activities required, they may differ. And then purchasing has 12 tasks identified. That purchasing task can be audited in association with any and every one of the other processes. So this is the way the audit is going to be conducted by the MDSAP auditor. There is a total of 90 tasks. Each task has a particular time allowed to do the audit, and we will see that later in the presentation. The audit model requires that we should conduct the audit in a following sequence, like an audit trail that we would have in any other management system audit. We must start with the management system, the management processes, understand the management commitment, and see if there is a management representative appointed, and do the management really committed to the management system. And then once we do that, we go and audit the measurements and analysis and improvement audit, process audit. And once we understand how the measurements and the risk analysis comes into that, and the improvement activities are being taken into consideration by the top management, then the next one we would audit is the design and development process. And once we understand how the product is designed and the process is developed, and once we understand those things, then the auditor moves on to the products and service control processes, or PSC. And purchasing is audited last in the MDSAP model. There have been occasions which I came to know that companies ask the auditor to do purchasing before everything else, and they will not do that. Purchasing is always audited either along with the other activities or as the last process that's going to audit. It may be reviewed in conjunction with the other processes like MAI or design and development or PSC, production control and service controls. And but the risk management must be reviewed throughout all the audits of all the processes. Risk is audited as an overall requirement for each process. The auditor try and see in each process and in each task, all the different 90 tasks, we identified what risk is there. Auditor will be looking for that, to identify that if there is a risk to the product or the patient or the provider or any other, and then they will be much concerned about that. So risk is audited as an overall requirement. When we look at the MDSAP audit model, we can see that there are some orange boxes there, and some requirements are stated in blue, italic, bold text. They are all giving us under a couple of clues. One of them, the orange box, is telling us where other places in other processes this particular task has a linkage and or interactions. And almost all, not all of the 90, but almost all of them have an orange box in the MDSAP audit model, which shows what are the other links, what are the other process links that we have. The letters or the requirements printed in blue italic bold, it is showing the relationships of the risk management, where will be a high level of risk and what should be considered. The auditor should be concerned more about the high-level risk on those requirements which are stated in the audit model in a blue italic text. So those are two indications of understanding the linkages and the risk levels in the audit model. If we look at a task, this is just an example of a task. The basic requirement of the task is verify that design and development changes are controlled and they are verified, and also they are approved prior to implementation, and also confirm that any new risk associated with the design change have been identified. If a risk is identified, we have to mitigate that. Auditor will be looking for evidence that you have a risk identification and you have a risk mitigation process if there is an identified risk. When we look at that, and for auditing that one task or one requirement, the auditor will choose the clauses from ISO 13485, different clauses, 421, 423, 71, 739, 7310. All those areas have something to do with design validation and developments and changes and verification, and all those class requirements will be looked into in relation with this one task. And also the auditor go and see if the participating jurisdictions regulatory requirements, their own GMP requirements are met or not. And in this case, the example I have given, there is a TGA requirements from Australia. You can see that there are several sections of the of their GMP requirements or their regulatory requirements. And we saw from Brazil, they have requirements also. And also then we have Health Canada, CAMDCAR 1 and 3 requirements will be looked along with that. And from Japan, MHLW, and we will be looking at several of their requirements. And for United States, we will look into FDA 21 CFR 820 Section 30. And see that there's a whole bunch of other legal requirements that we are looking at when we are looking at a basic requirement of the task or the audit process. This probably will give us an understanding of how the basic QMS requirement and the regulatory requirements are incorporated into the MDSAP model of the audit. And continuing with that, it did not stop there. And there are some additional country-specific requirements on top of their regulatory medical device requirements. Australia has their own country-specific requirements. You can see that when we are auditing that one design and development changes and verification and validation controls, then if we are supplying in Australia, we need to make sure that these particular country-specific requirements, not the GMP requirements, are also met. They have two different requirements there. Verify that the manufacturer has a process or a procedure for notifying the auditing organization whenever change happens. And also the second one is verify that the manufacturer has a process or a procedure for identifying a proposed substantial change to the design. Those two requirements are particular to the Australian country, and if we are supplying in that country, then we need to make sure, along with the other requirements we already had, we are also meeting this particular requirement, which is country specific. Going on with that, we can see that there is other country specific requirements. Brazil has its own, and if the medical device is evaluated, is already registered or notified with ANVISA, then we have to verify that design change was correctly and promptly submitted to ANVISA. That is their specific requirements, not one of the common ones. That's according to the Brazilian law. Health Canada has their own particular requirements about the significant change. Now we see that each country has, in addition to the jurisdictional requirements or the regulatory authority, which we usually call the RAs, the regulatory authority requirements, there is also country-specific requirements. Japan has multiple ones there. Two other requirements that we see there. United States has one of our own. Verify that the country, that the manufacturer has obtained a 510K registration and also post-market approval. And that will give us an idea when we're looking between these slides here that how much auditing needs to be done. Here is a basic requirement. From the basic requirement, there is jurisdictional regulatory authorities requirements, which we call the RA requirements. Then also each country has specific requirements that we have to meet. The auditor has to audit that all those things are met. Taking a look into the quality management system, IMDRF recommends a level 4 structure for the quality management system, which is very common and which is very identical to what we are always used with the other medical device or other quality management system documentation structure. They also look into process analysis to see where the risk is. They want to know if there's a risk in any process, any step. They want to identify that, and once we identify the risk, we have to mitigate that. Here I have given an example of a complaint handling process, and there is of course inputs, complaints coming into it, and there is outputs going out, but in between the input and the output there are several activities happening, several requirements are there. There is receiving the feedback and from the customer, and then documenting it, then making sure if it is a complaint, and also if it is a reportable complaint, and also keep a compliant file. And also we have the resource requirements, the competency requirements for the people handling the complaints, and without those clauses there are the ISO 13485 requirements, and how we going to improve the compliance process, what are the criteria that we have to meet in the complaint handling process, and how we can monitor, measure, and improve, what kind of records needs to be kept. All these things are looked into in each process, and this is a process analysis approach that the QMS usually uses. I'll just give a little bit of an input into a QMS process analysis, looking at the risk. We have a process step, and each process is supposed to have an expected outcome, and then we see what is the risk in that particular process and what kind of control methods are there. And we creating something like this, we could understand what is the process supposed to do, receive and document the customer feedback, then what is the expected outcome, understand the customer concern and the product failure in detail, and document everything must be documented, and also come up with a method of mitigating the risk and improving the process. In those two things, there is a potential risk. What is the missing identification and traceability, or what operating systems are not being considered, and those kind of things also are the potential risks that we will be looking into. And current control methods are what we have in the manufacturer's facility today to control these complaints and complaint investigation processes. Just give an example how we can look into into each process step and see what potential risk is there. And in a complaint investigation, if we are not determining the patient and the provider involvement, we are only looking at the performance of the device, not considering the patient, potential harm to the patient, or the harm or hazard to the provider. That will be a high level risk. And see, this is a method for us to analyze what is the risk involved in each process steps. Management representative is required for us. The management representative is the responsible person for making sure the requirements of the quality management system, that for the basic system for us here is the QMS is ISO 13485, and also all other requirements is efficiently and effectively documented, implemented, that people are trained, and also audits are conducted, and the requirements are effectively maintained. And say that prior to reviewing of any process, we're talking about the MDSAP process here, the various 7 processes, or at least the 4 primary processes, and the 2 supporting processes that we are looking at. We must first talk to the management representative, and if not available, they say a designee is okay, and understand how the process works, and what are the controls, and what are the risks that they have identified even before we starting the audit. And the management process is the first process to be audited, and from there we follow the sequence of auditing, like management process and MAI and D&D and PSC and purchasing as the audit trail or the sequence of auditing is suggested by MDSAP. The audit cycle, how long is the certificate worth? That's very similar to any other QMS audits. The certificate is worth for 3-year audit cycle, and the initial certification audit is a complete audit of manufacturer's quality management system. It consists of the same as we have any other certification audit, stage 1 and stage 2 audit, and the governing documents there are ISO IEC 17021, 2015 different classes. And stage 1 and stage 2 are conducted according to those requirements. Stage 1 is really a documentation audit to determine the readiness for stage 2. If the company has met the intent of all the documentation requirements, is the company really ready for the stage 2 audits? And then at the end of the 3rd year, we have a recertification audit. Sometimes in the MDSAP world, it is called a re-audit. And that will be at the end of 3 years. And in between, we will have surveillance audits, just like any other management system audit and certification cycles. But what is different here is, it is possible we will have special audits or unannounced audits, sometimes conducted by the regulatory authorities who are participating in these jurisdictions. And if they see that there is a high level of risk, or the non-conformities are severe, or things like that, then they will be scheduling either special audits, and they also do unannounced audits. That is the behavior of the compliance audit system. How is the regulatory auditing approach? To put in a nutshell, there are several methods, several audit approaches they use. One of them is top-down, the other one bottom-up. Sometimes they combine the both of them, and say combination audit, and also they just pick a product and walk all the way through and audit only the products to see if there is a risk or a harm in the market, or there is an issue, if there is a high-level risk identified with that particular product. And if there are no special events to be covered during the audit, so there is nothing, this is a normal audit, then they always choose this top-down approach. And audits which include potential significant safety issues, the audit approach can be bottom-up, start from the product and up backwards to the requirements. And for surveillance audits, a combination of auditing that they can surveillance audit, the auditor chooses is it going to be top-down or bottom-up method. As I mentioned earlier, if there is an issues with the products, and they will take a product and audit the product requirements and all the other performances and validations and testings and all those kind of things done on the product and identification, traceability, all those good things, just a product audit all the way through. This is the sequence that we see. This is auditors do not deviate from this. This is a given audit sequence. We will start with the management processes. And when we are auditing the management process, we will also can look at the device marketing authorization and facility registration, because that is the responsibility of the top management to make sure that those things are there. And then we go and take a look into the measurement, analysis, and improvement process, and that is where we are trying to see if there are concerns with this particular medical device. Medical device adverse events. Are there adverse events? Are they effectively handled? Are they reported according to the requirements of? Now it comes each country's adverse events reporting requirements, not just a one general thing. And once we understand those things, we take a look at the design and development. And when we are doing the design and development, we can also look at the device marketing authorization and facility registration. Is it effectively done, and is it, do the company already has the license? Do the license and the authorization includes the design and development process and the labs or any other kind of verification, validation requirements they have? And from there we move on to the production and service controls. That is the manufacturing controls, which has about 29 tasks to be audited. And you can see that the purchasing is in the bottom, covering all those requirements. So once we finish all those, or sometimes it is the auditor's decision, the auditor can audit purchasing requirements along with sometimes design and development or products and services also. On the top, we see the risk management. Risk management is considered and audited throughout every step of the audit. So that is to understand the MDSAP audit sequence and the audit model. That is the audit trail, if you will, or the way the audit needs to be conducted. And auditors are very strict to that. They do not deviate from this method and this audit trail. What has changed? We used to calculate the number of audit days depending on the number of employees. That is the ISO 13485 and other QMS methods. But here we are using a spreadsheet which depends on the tasks. And each process has different number of tasks, and each task is allowed certain time. And we take the number of tasks to be audited and multiply it by the number of minutes allowed. Just for an example, in the management system there are 11 tasks total, and each one is allowed 28 minutes if I remember correctly. And but sometimes we audit only 10 of the 11 because one of them is not at all relevant to this particular company, and that's how we calculate the timing for that. Once we understand how many minutes are required for all of them, then we will go ahead and divide them by 60 to make them the hours, and then divide it by 8 to make them the audit days. And there is a spreadsheet available for this, and also this can be manually calculated. The audit types, we have stage 1 audit, stage 2 audit. Stage 1 audit is a document review, a documentation review, to make sure that stage 2 readiness is there. And there will be times when the auditor conducts a stage 1 audit and then say, no, you are not ready. And stage 2 is determining the certification eligibility. Have the company effectively implemented all the requirements, and can they effectively manage the systems. Then we have surveillance audit that is conducted to do. Surveillance audit is conducted to do if the certification can be continued. And then we have the recertification audit or the re-audit, and that is to determine if the certificate can be renewed for another 3 years. Special audits, as I mentioned earlier, is conducted in response to the changes in the scope or to investigate potentially any significant complaints or any suspicion of or any products non-conformities or any other reasons where the regulatory authority determines this management system, we want to go in and see what is happening there. They can make this decision depending on the MDSAP audit report also, because the audit report will raise non-conformities in certain areas of the processes which they may have a high level of concern. Sometimes, rarely though, but they do unannounced audits. That is conducted by the regulatory authorities of each jurisdiction who is participating in the MDSAP audit model. There are peoples and functions involved. There are certain positions involved in the audit. One of them will be the program administrator who administers your MDSAP audit. That will be from your auditing organization, or which we usually call a registrar or a certification body, but in MDSAP we call them auditing organization, and there will be someone managing and monitoring the program. And then we have lead auditors and auditors, and if the auditor needs technical knowledge, we use technical experts, and the technical experts are used for evaluation of the technical details. And also sometimes we will have a regulatory related technical experts also. And at the end of it all, there is a final review. There are people who are there called final reviewers. Now there are different competencies needed for these different positions. They are all outlined in the MDSAP. Various levels of competency that we need for these requirements are given. There is prerequisite education requirements. Then there is prerequisite experience requirements for the auditors and decision makers. They differ a little bit, but all of them have those. Then we have prerequisite competence requirements for functional competency, foundational competencies and functional competencies and technical competencies, depending on what products the auditor is going to audit. The final reviewers and lead auditors, or any technical experts who take part in the audits, they have to undertake any new training mandated by the regulatory authorities. If things change or the regulations change or the requirements change, the RA will ask them to take update their knowledge and keep it current. And they will give you a time frame that has to be done within that time frame, or whether you are an auditor or a decision maker or an expert, and it's a possibility you're going to lose your license if you don't do that. Auditor competencies, just a little bit to look into that. Final reviewers and lead auditors, they must have completed the following training prior to performing independent work for an auditing organization. That means before they become an external MDSAP auditor. They must have minimum 40 hours of classroom training in quality management system. It can be ISO 9001. And anyway, whatever you are taking, either you are taking ISO 9001 or ISO 13485. If you are taking ISO 13485, a 40-hour training, which is equivalent to the lead auditor training, and you don't have to have any additional training there. But if you have a quality management system, basic ones, which is like 9001, then we must have an additional 8 hours of 13485 related trainings. The other thing is 32 hours of training in medical device regulations, compliance obligations for different countries and different participating jurisdictions, and auditing for conformity of those regulations and or any equivalent experience or knowledge that the auditing organization has some controls, that how they have to accept the competencies, how they have to determine, how they have to evaluate the competencies before they accept someone as a external auditor. And also we must have a good understanding of the GMPs of the jurisdiction's regulatory requirements, and also, as I mentioned earlier, country-specific requirements must be understood.
Folks, we'll pause here for a second for any Q&A. We have a few questions already. Type in any more questions that you have. So John, a few questions here. Here's the first question. What types of company should look at MDSAP audits?
Any organization that is supplying in more than one country, one jurisdiction country, like if you are supplying in United States and Canada, or United States and Japan, United States and Brazil. So in any one or more of the participating jurisdiction regulatory authorities should look into that, because more and more countries also are accepting MDSAP. as the method.
Okay, here's another question. Can we use our current registrar and auditor for MDSAP?
No, there are MDSAP auditors who are accredited to do that, and there are several of them. They must get recognition and acceptance from the IMDRF.
So,
I can give some names.
Yeah,
if they
sure.
want. I can throw some names for you. One of them is BSI, DECRA, DQS, Intertech, LNE, Lloyd's Registrar, NSAI, NSF, SAI Global, SGS, TUV Rhineland, TUV America, and TUV USA. All those are the, and also there is UL. Those are the accredited or rather accepted or recognized, MDSAP recognized auditing organizations as of now.
Here's another question. If you can share a suggestion in order to make the audit sequence effective in the audit process.
In MDSAP, we have to follow the audit process that is given by MDSAP itself. And also, when we look into the MDSAP audit model, we can see that there are sequences and linkages given. That following those linkages is the most effective way of doing that audit.
Another question, what is the management system? Is there a MDSAP management system?
No, it is the basic management system is ISO 13485, 2016 for now, and all the MDSAP audit is done from that basic requirement plus the regulatory authority specific requirements plus the country specific requirements.
Will the number of audit days go up or down from?
There are some adjustments, and MDSAP allows them. They are available in the documentations published, and we have to take a look into it. It depends on your product. Either you are design responsible or not, or your product goes through sterilization. Those kind of things will determine the number of tasks. It will reduce the number of tasks from 90 to certain lower amount. But it goes up if you are auditing multiple products or multiple family of products. Or if, for an example, if you are going to sample 3 suppliers, 3 critical suppliers, then the total time gets multiplied by the number of tasks to be audited.
Last question. Can Omnex provide MDSAP auditor training for organizations?
Yes, we can.
So it's right there on the on the screen there.
Yeah.
So, folks, with that, thank you very much for attending the webinar, and thank you, John. Thank you to the audience, folks. Welcome you to other Omnex webinars in the future, and or Omnex training, or any help that you might need in ISO 13485, ISO 14971, or the MDSAP program. Thank you all.
Thank you.
Bye-bye.